Do you ever feel like you're just going through the motions? Like the days sort of blur together and you're just quietly wondering to yourself, does any of this even matter? After the last few chaotic years, that feeling is more common than we realize. But what exactly is it? Is it the state of the world, burnout, an overwhelmed nervous system? Or is it something deeper, like depression? I've been stuck in this low energy apathy for a while now. Add in doom scrolling, procrastination, and a quiet habit of isolation, and it's hard not to wonder, is this just life being lifey, or am I actually living with some level of depression? When does sadness become something more serious? And how do you know when it's time to ask for help? Today I'm joined by Dr. Sandi Ramsey, a compassionate and deeply experienced nurse practitioner who specializes in treating depression. I want to unpack what depression really looks like, how it can quietly show up in our lives, and what we can do for ourselves and for others to move towards feeling better. This is a big topic that I really want us to demystify, destigmatize, and establish some understanding, compassion, and normalcy around. Welcome to Humn.ing.
The Humn.ing podcast is all about the imperfect art of being a human, where we learn from wellness practitioners ways to heal, love, and grow. Brought to you by Zavora Marketing. You're trained to treat people, not build funnels, manage SEO, or run ad campaigns. But without visibility, even the best practices get overlooked. That's where Zavora comes in. We help wellness pros attract new patients with modern marketing that actually works. No tech headache required. Visit zavoramarketing.com today.
Sandi, welcome to Humn.ing.
Thank you so much for having me here.
I'm really excited about this, but we really have to send a big congratulations on the opening of your second location in San Diego, California. The grand opening was last night and it was a huge success.
I am so grateful that it was. Yeah, I'm so excited to be here in San Diego now.
Yeah, it's an interesting combination for a wellness practice to do both mental health and aesthetics. Usually It's kind of one or the other. What was the idea behind doing that?
Because I feel like people that have gone through some kind of traumatic event in their life, like Bell's palsy or something like that, that has caused permanent damage to their face, and sometimes it affects their self-esteem, it affects their own well-being and their mental health. So this way we can also reach out to them and help them with the outer layer. So I work on the inner layer to help them heal within. And then my son, Brandon, he's good with doing the aesthetic portion and helping even out the face. That's just an example,
right,
to help them with the imperfection that they have on the outside. But he also does all the other things as well with the cosmetic, doing Sculptra and the peels and all those. Okay. So, but that's mainly what I wanted to do, was just because mental health is really your core well-being. Really. So if you don't have the foundation of your well-being, sorted out for you, then those imperfections on the outside can really affect you. And so that's why we also offer that. So he was saying that it would be great for us to be able to offer both here in San Diego. So that's what I really wanted to be able to do.
That's awesome.
Yeah.
Tell me a little bit about your background. How did you get into and go to getting your doctorate? Mm-hmm. What was life like before, and what was the sort of the motivation for going down this path?
Okay, since I've been in this field since I was 14 years old, so I've worked in many different areas, and actually I've done mostly primary care. I've done emergency room, I've done orthopedics, I've worked in many fields, but I really feel like when it comes down to it, is your mental health really is the foundation of everything. So then I was like, I want to go out and get my psychiatry so I can see if I can help people manage their chronic illnesses even better. And then I found out that really mental health is truly the foundation. So I really want to focus on that more to help people more understand that and feel better about themselves. Because I really feel like it just takes over and they can't see past it. And so the love of doing mental health and having that knowledge and knowing that I can care for them in other ways, like their blood pressure, hypertension, diabetes, things that really are chronic for them, to be able to handle it more.
So you were mentioning a lot about trauma patients, mm-hmm. and I know that you deal with a particular type of depression, treatment-resistant depression. Explain what that is and what is your sort of prescription generally for these types of patients.
For the treatment-resistant depression. So really when we talk about treatment-resistant depression, we talk about people that have tried different types of medications, they've tried different therapies, and nothing's really working for them. So we offer Spravato, which is esketamine. It's a nasal spray that they come in for. It's a 2-hour treatment that they would come in either once a week or twice a week, and it works on a part of the brain that helps with motivation, energy, good feelings, everything. It's just it makes you feel better, and that's why a lot of people like that. But it gives them that boost to help them get motivated to do something for themselves, want to get better. So it's a great medication to help them, and insurances pay for that. So we just have to get them qualified for that. But it's a really good medication to help them with motivation and energy and feeling good.
How does that compare to some of the other medications that are prescribed for depression?
Medications target different areas, like norepinephrine, dopamine, things like that. So, and it also takes, oral medications usually take a lot longer. It usually takes 4 to 6 weeks for you to start seeing some kind of improvement. And with the Spravato, it works immediately, so you can feel the benefits right away.
Yep.
So it's a really good medication. And it's been around for decades. And it's just now becoming FDA approved. It became, I believe, FDA approved about 8 years ago. And large studies have shown that it really makes a difference for people. It helps them with their resistant depression that they've been dealing with. So,
but it takes a few tries and trials for a person to get to that level, which seems to be, more of an extreme case of depression. Are there levels of depression, or is it just what works for you?
Yeah, it's really the goal here really, for a long time, has just been medications. And honestly, medications only help you about 50%. You need the whole team. We need to be able to help you change your habits so you can see things in a different way. And then mental health therapy is another thing that you need to work on. And then the medications do something. So it's a combination of things to help you get there. And so when we talk about just medications, it's not just going to be that, So if it's not a one-time solution, it's a whole small steps to get you where you need to be. But Spravato can help you with that boost that you need instead of all the other medications that are out there.
Got it. So if it is sort of activity and motivation and habits, what's the difference between actual clinical diagnosable depression and somebody who's just sad?
Okay, that's a good question too. So sadness is a normal response that we have as humans. But if you go longer with sadness, like not being able to eat or fatigue or not being able to sleep, and it's been going on for more than 2 weeks, then we're looking at something that is medically diagnosed as depression. So those are things that are affecting you. Even loss of interest in doing things, loss of energy, all those affect you, and that's the sadness that you're feeling. And so if you keep going on for that with being untreated, that would be depression. And then if you get medication and you continue to have depression, then that is treatment-resistant depression.
But I feel like a lot of people are sad and maybe they sleep okay, but not interested in certain things. How do you know if you might be experiencing depression or just long-term sadness? Because
so longer than 2 weeks of sadness of all those things that I've just listed,
okay,
like fatigue, change in appetite, decreased sleep, loss of interest. Did I already say that one?
Yeah.
Okay. Those are the main ones. And if you're experiencing any of those, it doesn't have to be all of them either. Just one of them, longer than 2 weeks, then we're looking at depression.
Huh. And so when you're looking at a person who is coming into your office for the first time, what are the ways that you are assessing them and deciding whether or not it's depression, and then what sort of treatment level that they would need, whether it's just habits or actual medication.
Okay, that's a good one too. So my evaluation, we have to know your whole history. I go through your whole life to figure out how you got here and what has happened to you that has made you feel like this. So that's my evaluation. And then after that evaluation, then we can decide whether medication is the way to go. I'm not always about medications either, though, but they do help us at the beginning to help you get that boost that you need too. And even though it takes a little bit to get going, it's still figuring it out what it is that you actually need. You know, so going through your whole history is a lot, you know, your whole lifetime. So, but that's how we figure out where you're at in your depression, and also your thoughts. What's going on with your thoughts? And then if you've had any self-harm, because sometimes people feel like they need to harm themselves. And I want to know all those things, and that will really tell me. It's not really levels of depression. It's like, what type of depression are you having? Trying to figure out how we can help you. What has happened in the past? Has it stuck with you? All these things we need to take into account to figure out what would be the best treatment for you.
Do you find that people are willing to volunteer and give those answers? Because those seem really deep and
They are.
shameful.
Yes, and those are the things that we need to talk about, because I don't want you to feel ashamed of those things, right? We don't want you to feel, it's your perception of what you feel. So it's really building that rapport. A lot of times that's true. A lot of people don't just want to tell me those things. So it's having that communication with the patient so they can feel safe, that they can tell me those things. We build those sometimes. Sometimes patients feel right away that they can tell me those things. And then it takes me a little while to get to those, you know, those things in the past that affected them. But it's always at the beginning, I try to get those things from you.
So I'm like kind of looking at myself. I'm like, no, I've never had a problem eating, never had a problem sleeping necessarily. So I'm like, okay, those are fine. But I'm like looking at like the loss of interest. Like there's a lot of times where it's just like, I'll go through a few weeks and I'm like, don't know, what am I doing? Why am I trying this? Like nothing's working, blah, blah, blah. That's probably not at that level that you would like look to for.
It is.
It is.
It is something that I would look at. Yeah. Because I don't want you going longer than 2 weeks of feeling this way in any way, or even loss of concentration. So I said loss of interest, loss of concentration, change in sleep habits, change in appetite, all those things. Only one of those is already a symptom of clinical depression to be diagnosed. So
Wow.
longer than 2 weeks is really the key.
Okay. But I feel like, especially after isolation and, the changes in our work and our community, like the loss of third spaces, the loss of real human daily interaction, that can be applied to so many people. Like I can name 20 of people that are like, oh yeah, that's normal now for me.
That's not normal.
It's not normal.
It's not normal.
Is it though the times that we're living in, or are we just not adjusting to today's reality?
You should never have to adjust to today's reality. You shouldn't have to do any of those things. So if you're still feeling those feelings any of those during COVID and isolation, that's still not good. That's still depression.
Yeah.
Yeah. You should not be feeling that way. It's not adjusting to anything. So your mind does three things. It compares, it describes, and it measures.
Okay.
It doesn't know what's right or wrong. It doesn't know what's good or bad. So your mind is controlling you.
Right.
You are not controlling your mind. And so because of that your mind is doing all those things, those are the reasons why you're having all those feelings. Continued. They're not good feelings. They're things that you don't feel good. Sometimes you can say you feel numb. You don't have any real joy. You don't really have happiness. You're just numb. But that's not a way of life. That's not how you should be feeling. You should be feeling peace, calm, clarity. You could even have creativity, joy, all those things every day. So imagine.
Every day.
Every day.
Wow.
Yes.
Because I know I get creative bursts, You're you're sitting in one right now.
That's because you feel good.
Yeah. And, the maintenance of it. And so I think when you're talking about habits and rituals that you should have, when you said that your mind is what's controlling you, that to me would indicate having a strong meditation practice so that you can disconnect from your mind and realize it's just up there monkeying around and you're in control. Is that inaccurate?
Somewhat, yeah. Really what you want to do is not have those thoughts. You should always be in the present moment to enjoy life, to enjoy what's going on at this moment. So, because you let your mind control, it's all the could-haves or would-haves or all those things or images that you've had in the past that might bring up bad things. And sometimes you'll have good thoughts and feel good about them. Those are the ones you want to keep. But are the ones that keep bringing up, that keep showing up, that make you feel bad, those are the ones that you need to control. And how is that? It's because things, if they already happened, they're in the past, right?
Yeah.
Anything in the future, we don't know about. So why are you worrying about the future? Let's think about good, what you want for the future, outcomes that are good. But if you worry and you stress and you're thinking all these negative, even self-negative talk, like, I shouldn't have done that. That was stupid. That was a bad move. All those negative talks to yourself is negative. It's bad things. Those are bad thoughts. Those are bad feelings. So those are the ones that we're trying to get rid of.
But I feel like that's so, at least in my experience, that's just so common. I know I'll be going through a normal day and some weird, random, embarrassing thing will pop up in my brain. I'm like, why would I think of that? And I got to a point where I'm like, I crush it. I'm like, nope, we're not doing that. Go
That's
away.
right.
But, it's still there and you still have that quick feeling of like embarrassment, like even though it was like 10 years ago and you're like, why did I do that? But I don't even know that person anymore.
Yeah.
But they pop up. So are you saying that we need to have better control over our minds and our thoughts?
When you have that thought, for that next second, you say, I realized I have that thought, and just put something good. Okay, that happened. I acknowledge it. I don't want you to squash it down. I don't want you to push it down. I don't want you to forget it. Acknowledge it.
Yeah.
Because that way you're saying, I accept it. I'm okay. I'm not ashamed of it. It happened. I let it go and move on. That's how you do it. But if you keep trying to squash it and that was embarrassing and I shouldn't have done that and you're still thinking that thought and you still feel that way and pushing it down, it's always going to stay there.
Yeah.
So you have to bring it up, acknowledge it, because that is like accepting that feeling. So you're that not pushing it down, and then it lets go, and it's not there, and it won't pop up anymore. It shouldn't pop up. So every time you do that small action, that you acknowledge something that happened, and it pops up, and you change it for that second, that small step adds up.
Yeah.
They keep adding up, and before you know it, you're not having that thought anymore. You're not feeling that anymore. So it's just like working out.
Right.
So when you're exercising and doing things to get muscles and do all these things, you get sore, right? You get uncomfortable. You go through these stages. That's exactly what we're doing with your mind. So it's those small steps like working out, and every time you do, you're going to get more muscles. You're going to feel better. So is your mind. So that's what we're trying to teach you all the time. So when certain things, like example, when we have a session or when you come in for your appointment, we talk about this, we address it. Then my mental health therapist helps you finish it out. So we make sure we keep changing it. So you're not thinking those thoughts anymore. So you can have joyous days. So you're not going through 2 weeks of feeling sad or feeling tired, or you can't eat, or you don't know what it is that's bothering you, or you can't figure it out. Even things in the past can hold us back as a child, thinking that we have to struggle every day,
And that's a lot of programming
Right.
from, past generations and old ways of thinking. I grew up in Indiana, and there's just a way of life in the Midwest, and it's tied to struggle.
And working hard. You have to work hard, or you're not going to get what you need. And you got to struggle to get through this. Yeah, struggle through life.
And I was just like, that's the thing I'm really learning now. It's just
we grow up with that thought.
Yeah.
That's all we do
It's like
is
you
know that
don't
we have to struggle.
Yeah.
We have to struggle. If we're not struggling, we're not getting where we need to be. And that's why I'm trying to tell people that no, That is not it at all. I promise you. It's not. I promise you. I know. I had the same upbringing. And some of us have trauma. We have trauma. We all have trauma. So I'm so grateful right now that we can talk about this mental health so everyone can get help and know that it's completely normal. We all need guidance to help us get back on track, to look at life through love and guidance instead of looking at it as a struggle and painful and like this is how our life is supposed to be. No, I don't want that.
I mean, I honestly came into this conversation thinking that most people experience sadness and they just happen to call it depression because it's a word that we misuse all the time. But having sat here, I'm now questioning, like, are more of us depressed than we want to admit?
Yes.
And then is that then a stigma that we need to uncover so people can go even just to talk therapy, let alone, mental health, depression doctors like yourself?
Exactly. That's why this is so important. And I'm so grateful that you did this because a lot of people do walk around thinking that this is normal. This is how I'm supposed to be feeling, like numb. Sometimes I feel happy. Sometimes I feel good when I go out. But no, it's supposed to be like this every day. I know. When I found out about that too, I was like, oh my goodness, I need to tell everyone. I want everyone to change the way they're thinking. When I realized that's how long I've been in this field. I've been working, trying to help people with family, with primary care, doing all these different things to try and help them. And when I realized that it truly is your mental health is the core of well-being. You need this foundation to help you know that life is not supposed to be a struggle. Life is not supposed to be sadness most of the time. I'm not supposed to be working every day, working from paycheck to paycheck and not enjoying my life. You need to find joy in your life. You deserve that. It is your birthright to have happiness and joy in your life every day.
So what are some practical steps that a person can take? They find themselves in that 9-to-5 rat race, commuting. I don't know why, but people are being forced back into the office. So stupid. Maybe they have kids. Maybe that's a grind. They're living a typical American lifestyle right now, and they're subjected to the news and outside pressures. Like, how do you stop that roller coaster and move into a more space of happiness?
I want them to first acknowledge that they have something that's going on. If you have any of those symptoms, loss of interest, fatigue, no energy to do anything, losing concentration, not eating well, or just changing your appetite, and just feeling sad. I mean, for longer than 2 weeks, I want you to get some rest. I want you to do something for yourself. Go outside, walk around, whatever it is that you need to do to try and help yourself. Make sure, too, that you're eating. Yeah, you're eating and try and get some sleep and reach out to mental health.
Eating good stuff.
Eating good stuff. Yeah, because unhealthy things will make you feel bad.
Yeah.
You go to McDonald's and you don't feel good already, it's not going to make you feel better.
Yeah.
So you need eat healthy, working out is super important for everyone, for their daily mind. And yes, meditation is awesome if you can do it. A lot of people say that they can't do it because they can't get their mind off of it. And I'm one of those people as well. But it's so important to take time for yourself, to love yourself, to acknowledge that you are a good person, that you're here, that you love yourself. You have to love yourself too and respect yourself. To make the move, to make the choice, to make yourself better. Well, it's a choice.
Yeah, it is a choice.
Yeah.
And I know that this is a common theme that is hard. This is a common theme that is spoken to so many women and so many mothers. You have to take time for yourself. You cannot keep putting the oxygen mask on the baby first kind of mentality. And so as a mother, what are some things to do to make sure that you are taking that time, that space to find the joy so that you stay in a happy space and not get sad or overwhelmed?
That's good. So either morning or night is one of the most important times that we actually take for ourselves because we're just waking up or we're getting ready for bed. So I always say at least take a few minutes in the morning and look in the mirror and say something that you love about yourself. And I always say also to write gratitudes of some sort, 5 to 10 a day in the morning or at night. You have all your fingers and toes. You have a family. You have a home. Anything that you can take to be grateful for that moment, just take a few minutes. That's the beginning. That's the beginning. And then get help. So go reach out. There is so much out there now. I'm so grateful that really we can talk about depression. We can talk about all these things now. I'm hoping that we're getting rid of all the stigma that comes with that because everyone needs guidance and help to know that they deserve joy and love and happiness in their life. And those are the first steps.
Yeah. Yeah. And I think it's sometimes we look at social media and others and life.
Definitely.
And everything is like everything out there is rainbows and sunshine. I love TikTok because there is an element of vulnerability on TikTok. It's going away. It was very prevalent 2001, 2002. But I think we need to understand that, yes, there's a lot of joy that people are experiencing and they're sharing that. But when there's not joy, they're not going to share that on their feed,
Right.
Right. And just understand that if you're looking at that and wondering like, what's wrong with me?
Well, remember what I told you about your mind. Your mind compares, describes, or measures. When you go onto social media platforms or you go through anything that's going to give you these highs and lows, you get all excited, you see something good on social media, and then boom, you see something low that it makes you feel bad. So yes, social media and different things like that can get you to feeling bad about yourself. So I would say be careful with the social media and all those other things. It really is. It's scary that you have so much knowledge out there as well, but it's not always accurate.
Right.
And then you have all these different things that you see other people do, and you're comparing yourself to those, and then you're measuring yourself by other people's things that they have or assets or whatever it is that you're comparing yourself. But all those things happen.
Right.
So those are the things that you need to really try to stay away from. They're not good for you. But we're constantly doing that because that's how we were taught. That's how we were raised. So we don't know any different. But now we're learning that we can do things differently and we can have different things. Honestly, anything that you want to have in this life for yourself or you've thought for yourself in this life, you're meant to have. Yeah. They came to your mind because really there's something that you desire or that you want. And you're the only one that's holding back from letting that happen.
And that's a big shift in understanding. And I know so many people back in Indiana, back home, they don't have that understanding because the opportunities are not prevalent or they're not tangible. So they can't understand and appreciate, I have to create. I am a creator. So I have to create my own opportunities. And if I want it, I can have it. The why or the how doesn't matter. It's
it doesn't matter.
Doesn't matter. Yeah.
It's just that you have that thought that that's something you want. As long as you keep, feeling good about what you're trying to accomplish, other doors will open. They'll come to you. Doors will open for you. As long as you stay focused on what it is. But at the minute that you feel bad about it, that you don't, you have doubts about it or anything that could come into your mind to destroy that, then you're killing your dream, instead of building on it. So really, when you're feeling good and you have your mind on the right path, it's clarity, it's creativity, it's calmness, it's peacefulness. All those things, once you have it, you're not feeling that numb and stress and anxiety.
Yeah.
Or having to do. Why isn't this happening? Those are all the bad thoughts. So it really is changing the way you're thinking, changing the way you see things. It's one of the hardest things that you think that you need to do, but really, it's the truth. If we walk around every day for one of those symptoms for the last 2 weeks, that's not good.
Yeah.
Yeah.
And, it is about habit and routine because I'm like, all the stress, all the bad thoughts, all the anxiety really comes from paying attention to other and not myself. When you're scrolling on TikTok or you're looking at news on YouTube, you're like, everything is burning down around me. This is terrible. And then you start to internalize that.
Right.
And so many times over the past few weeks or months, I have looked at something and I've noticed myself getting anxious or scared or whatever. And I'm like, you're getting sucked into the matrix. Stop it. This is not real. And you can choose another, reality. And then it's crazy. You drive to work and you're like, look at the blue sky. Jesus, that's really pretty. Like nothing is really wrong when you get your head out of your ass and look around and you're like, oh, look, there's birds chirping. And I was driving into work a couple times. I'm like, I saw like 4 raccoons over 3 days. I'm just like, oh, another raccoon. Oh, look at that. Just paying attention. And like you said, being present in your life.
You need to be aware.
Yeah.
Nothing really comes from the outside world. Everything comes within. Whatever you feel or how you're feeling comes within. Energy is all around you. So, and you are energy. So what do you want to put out? Whatever you put out comes back to you. Trust me. If you do harm to someone, it will come back to you. If you do good for someone, it will come back to you. What would you rather do?
Yeah.
What would you rather do?
What I find really interesting about you and the profession that you're in is, you have a doctorate. And again, from the upbringing, that has been programmed into my mind of a certain thing, a very, obviously educated, but critical thinking, blah, blah, blah. The spiritual woo-woo does not necessarily come into that equation.
No. Yes, I have a lot of people thinking that I'm like really religious or really spiritual. And honestly, I started doing some research on the law of attraction, like a lot of people, and manifestations and all those 20 years ago. 20 years ago, I did that. And I've realized over time that because I wasn't doing it on a daily basis, I just did it here and there. I want to feel good. I want to do it. So I try and focus for a while. Oh yeah, that worked. That felt good. I got through, and then I just thought life continue on the same. I didn't do it again. Then I do it again. I wasn't feeling good, and I do it again. And then I realized there is truth to this. That's why there is so much out there on this. It is so true that if you think good thoughts or feel good, or you can create things in your life that will come to you. Doors will open to you. I never thought to get my doctorate. I never thought to get be a double board certified nurse practitioner. I started as an RN. And then the nurse practitioners were coming up available, and my kids were in high school, and I really love helping people. And I've been in this field for a long time, so I thought, okay. And then the more I got into it, the more I started learning, doing more research, and finding out that, yes, that's how I got to this point. And I don't do things like a normal provider because I'm going to tell you that I feel like this is the way to go. I know you can do this. I'm going to help you get through this. And I do a combination. I work with my mental health therapist. So I do tools, she does tools. So we're making sure that we're changing your old habits and you're not feeling this constant numbness or just not feeling good or not just being there. I want you to enjoy life. You should have all that. So that's why I wanted to do this. And I didn't know if it was going to be successful or not. And I am so grateful, so very grateful that so many people have also been through it with me and has seen results. There are debilitated patients that were on pain medicines that have couldn't get up in the morning, be debilitated in their bed for days, are now getting out of bed, having a normal life, enjoying life. And now that I know that it works, I just want to keep going. I want to keep going. And that's why when my son said that we could come to San Diego, he thought it'd be good here. Then I was like, yes, I'll do it. I want to. And then knowing that he can help me with aesthetics, and because we offer so many things, but just knowing that we can help them heal on the inside and help them glow on the outside with my son is magical for me.
Yeah. You said something interesting is when you started your journey, you were not consistent with it. Started, stop. And that, if you knew how many times I started a fitness program and went a week before quitting, is that in essence or in part what having a therapist is more of like a coach to help keep you consistent and keep you accountable to doing the work?
It's more than that.
Okay.
Because
Is that a part of it though?
oh, it is a part.
Okay.
It's a huge part of it.
Yeah.
Yeah. But the techniques that we use, the different things that we use to try and help you to understand that you need to do it on a daily basis is really important. And that's also another thing that I've learned, that it has to be a daily thing in order to make change, in order to see progression, in order to see results. So it's so important.
Well, and if you look at your daily routine, like everybody has a daily routine, whether you know it or not. And so whether that daily routine is waking up and grabbing your phone and scrolling through your email while you're still in bed, that's a routine. It's not a positive habit.
Exactly.
So you can switch that with a positive habit of journaling and gratitude for that same 5 minutes.
Exactly.
And it's that assessment of like, what am I doing with my time and my day, and what little shifts can I make?
You just nailed them. That's all of them. Because honestly, it's from the moment you wake up, and grabbing that phone is the worst thing you can do for yourself. And everybody knows that, really.
Everybody knows it.
Everybody
We all
knows, but
do
they
it.
still do it.
Yeah.
Exactly. But you got to make a choice. So these are your choices. So I keep telling you, you can do that if you want to, but do you want change?
Right.
We need to make a choice here. Every thought that you have is a choice. So you decide what choice you want to go. What path do you want to go on? So I want to make sure that you choose the right path.
Right.
You choose a good path. You don't want to go down a path that's going to keep spiraling down every time you go down it. So I want you to be aware so that you understand that you make a choice every day.
What does what does it take for a person to get so uncomfortable in their comfort and their daily bad choices to get to that point where they want to make a change? So that they're not, because again, they have to look at the difference between sadness and depression. And a lot of times we're just in comfort in our lives with the phones, with the TV, with the junk food. What is that impetus to get a person to want to change?
That's why I feel like some people like isolate, or they get so stuck in their routine that they can't get out. That's why I say take that moment and shift it. Like, get some rest, take a walk outside.
Yeah.
Something to make that shift, or eat something good and healthy, and then think about it at that time. I'm ready to make this choice to go and get some help, or because really it's just that one reach. If you could just do that one reach, you're doing a good job for yourself, So it's making a choice. And then now that we're letting people know and educating them that what sadness is, because truly, I don't think people know the difference between sadness and depression. And most people
It's
do
2
know.
weeks.
2 weeks.
2 weeks.
2 weeks.
Okay.
Yeah,
Which
2 weeks.
is
Consistently. So if you're even 1 to 2 days a week, let's just say 1 to 2 days a week, you're feeling sad for 2 weeks. That's not good. You should not be having 1 to 2 days a week.
Yeah.
You should be having once in a while, not on every other day.
right.
Yeah. So that's not good. You should not be feeling that way. And I'm not saying that everybody needs meds.
Right.
Okay.
Right.
So
that's not because
Yeah.
you told me once it's only 50% effective.
exactly.
So
Yeah.
tell me a little bit about that.
So that's why I say it's really educating you, helping you understand what's making you feel this way.
Right.
We have to dig deeper. It's going to take a little time, but these small steps that we take help you get there. So that's why I say it's just educating you, talking you through, figuring it out, and we do it together. And then you can see too, so we work together, and sometimes medications help you. It just depends on what's going on. How sad are you feeling? Is there something that I can do to try and help you so you're not feeling as sad? I want to do that too, because that'll help us in this path, right?
And you probably need a professional and not a friend, because it's not typical for us to open up this much
Right.
to a friend, even a spouse.
Right.
So the importance of having a professional to go and talk with, and
Well, I'm sorry to interrupt you. I was just going to say it's because we also are dealing with something that's happened in the past, and it's a delicate thing to go through, or to relive, or even just say a word about it. So that's why I say it's really important that you talk to someone that can have knowledge on how to handle that and help you through that. Because it can be very unpleasant. It could also trigger certain things. So you need a professional in order to help you through that. I would never want you to go through these things on your thoughts or things that have happened or trauma, anything in the past by yourself. Because I would want you to have guidance and help with that. Yeah. So you would need to reach out to someone for that.
Yeah.
Yeah. That's why there is mental health and the psychiatry, so we can help you with that balance and help guide you. But I never want you to do that by yourself. Yeah.
It definitely seems like you're looking at a lot of factors.
Yes.
And that's what I think is really interesting about this field of health and wellness, as opposed to your traditional Western medicine primary care. You are looking at the whole person.
I am. You're right. I am looking at everything. I'm looking at how you're handling it, what your religion is, what your culture is, what your past is, everything. I look at everything. It's a lot of information to go through for a person, but honestly, we ask all the right questions. We know how to get you there, and then we can figure it out for you. Yeah, it's a lot. It is a lot. We go through a lot because we want to know everything. In order to help you, we need to help the whole person. Yeah.
How do you do that and not get sucked in to the other person's problems? Like, it seems like if you're trying to dive deep into a patient and get to know as much as you can about them and their trauma and their sadness and their whatevers and their past, like, that to me could be a slippery slope into your own sadness.
That's why it's not just me.
Yeah.
That's why there's a combination of people that help you get through there. But that's the main thing, is all of us working together. It's not an easy process. I mean, it really, but it can be freeing. It can be liberating. I think once you start going through the first steps, you're going to see that it's so helpful for you to go through these steps if you're feeling this way. Yeah.
Okay. What are some practical things, and we've talked about a few of them, but what are some tangible, practical things that a person can do to help snap them out of that? Because maybe they are skirting on the edge of actual depression. Maybe they're in there and they can pull themselves out on their own with some actionable, like, things that they can do.
That's a good question, because it's not like something you just pull out of if you're there. So, but to have a positive thought, just hear a good song, think of a happy thought, dance around for a second, anything that can bring you out of that feeling for a second, that small action is what you need to help you. But if you need more than that, and you're not there, and you don't stay at this happy feeling or even past numbness for more than 2 weeks, then the one thought or the one, it's not just going to do its job. It can, I guess. I don't know that. Usually if you're already feeling this way more than 2 weeks, you can try those things. And I definitely want you to try them all the time. Okay. Yeah. I always want you to try and feel good at any moment that you can. But if that's not lasting longer than 2 weeks, I want you to get some rest, walk around, eat something good, and then reach out. Talk to someone you trust, and then also reach out for a mental health person. Yeah.
And that's, I think, the biggest takeaway here is it's not a bad thing. And you don't necessarily have to commit to a lifetime of therapy.
You don't.
Yeah.
No, you can come in, get a few things that's helping you and getting you in the right path. Some people do. Some people can get right on, and they start working on it, and they start feeling better, because we do tools. Okay, that's the other thing that I want people to understand. We don't just talk to you and give you some ideas and things for you to try. We're literally giving you steps to help you change the way you're thinking, because that's the idea here. And most people, their minds are running them, and they're not running their minds. And that's why you're in this routine every day, same thing, numbness.
Yep.
That's not a way of life.
And the tools are not taught to us. I mean,
that's right.
We've talked about it. Like, we are sort of brought up and programmed in a certain way. And so these other tools and ways of thinking and ways of being are just not common knowledge.
No.
So you need to learn them.
Yeah. I mean, they're becoming more available for people. I think definitely people that are researching and that it seems that when people hit rock bottom is the time that they want to make that change.
Yeah.
But honestly, you don't have to wait to hit rock bottom, okay? We can start, I just want people to know right now, if you're feeling numb and you go every day without any joy and happiness longer than 2 weeks, please try and do something to change and do something to find some happiness. And if you can't find happiness longer or any joy for 2 weeks, please get some rest. Eat something good. And then walk around and then talk to someone you trust and then reach out to a mental health therapist or a mental health provider to get the ball rolling to help you get there, because you deserve that.
If we have somebody in our lives that we care about, a friend, a family member, or somebody like that, and we're getting the sense that they may be really sad. And I'm thinking about men and young men in particular. Right now, there's a lot of talk about the epidemic of young single men and the sort of struggles that they're dealing with. How can a friend reach out to somebody, and what should they do to confront somebody who they think might be, dealing with a little bit of, long-term depression?
That's a really delicate subject for a lot of people.
Yeah.
And so addressing it with compassion and caring, because honestly, you think that they don't want to really talk to anyone or anyone, but they're not being seen and they're not being heard.
Yep.
So showing that you care and that you see that's, you don't even have to tell them. You can just say, I can see that you're not feeling that good, or you're just not yourself, or anything with compassion to let them know that they should talk to someone. It's important. If you're just letting it go, they're being untreated. They're not getting knowledge. They're not being seen. They're not being heard. Those are the things that we need to do for everyone. Is the problem here, is they feel like they're not being seen, not being heard. And that's what they'll just keep going down there. So addressing it and is important.
Just showing up and being a friend.
Yes, showing up and being a friend and showing compassion.
Yeah.
And letting them know. Yeah.
I think that's huge. Is we all want to be seen. We all want to be heard and understood. And
that's right.
That's
validate your feelings.
Exactly.
Yeah.
Yeah. The podcast is called Humn.ing. It's the imperfect art of being a human.
I know. I love it.
All just trying to get through it all. So
because educating people
yeah,
is the most important thing right now.
Yeah.
And I want everyone to hear everything that we can provide them, really, to the education.
And understand that it's available and it's okay.
It is okay.
Okay to go
there
out and
is
get
no
it.
stigma anymore. The depression and sadness is out there for everyone. We've gone through so much with COVID and the isolations. There's nothing to be ashamed of. There's nothing to worry about. You can talk to and really, honestly, you're the only one's going to reach out. No one else is going to know.
And that's going back to the whole thing. Like, you are in control of your life. You're in control of your happiness. You're in control of the things that you want. You've just got to go out and do it.
That's right.
Make
a choice.
Yeah. What's something that you're still learning about being a human?
I think that's every day. Every day learning being a human really is seeing different humans all the time with all their personalities and all that. It's always, everyone is so different. We're learning every day, increasing kindness, increasing being thoughtful to other people. That's the main things. It's just being compassionate, caring, and kindness every day. I is learning that every day, because you have to keep increasing it, because you meet all different types of people, and different people have different energies, and they come at you with different things all the time. So it's reacting to it, learning how to react to it. It's learning how not to react to it.
Right.
So that's what it's about.
And understanding that when you're giving that out, it's going to come back.
Right. Yeah. Exactly. Always knowing that whatever you put out comes right back to you. So
yeah.
That's an everyday learning.
The Matrix will easily pull us back into the chaos. And it's just like at what you said, step outside, eat something good. It's like, look around, find some squirrels running around, and you're like, oh, look, everything's great.
Yeah.
You
It's
know?
just taking that second. As long as you can take 1 second, boom, that's amazing.
Yeah. What do you wish more people understood?
I would say their mental health.
Yeah.
I wish they had a better understanding of what, we all have a purpose here. And our purpose is really to help others. Even working at McDonald's is serving another person. It's helping another, being kind, giving a smile.
Yeah.
It's those little simple things. That's what we should be doing every day. And I'm hoping that we can all increase that every day.
It's about, really, that's just about being a good neighbor and a good member of the community.
Being a good human.
Being a good human.
Yes, that's all it is.
That's all it is.
Giving a smile to another person is shocking. You'd be surprised on how somebody will be surprised that you give it and give you another smile back.
Yeah.
What a plus, So I just want people to really know that life is meant to be joyful. You're not supposed to be struggling and being unhappy and walking around numb. I want them to know that they can have a better life. It's a choice. We can do it. We can do it. We can help you. Yeah.
Sandi, how do people find you?
Okay. They can just go to my website at Heal & Glow Wellness, because I'm telling you, what we are all here to do is walk beside you and help you get through all the changes that you need for your mental health, because really mental health is the core of well-being, and this is how we help you. And we walk side by side with you and help you through this journey. So they could just go to my website and reach me that way, or Instagram. Right? Is there anything on Facebook?
Instagram, Facebook. I have shifted my thought on depression, understanding that it's a difference of sadness of about 2 weeks, and that more of us need to get out, touch some grass, and talk to a professional.
And you deserve happiness and joy.
You deserve happiness.
You deserve it.
And it's a choice.
Yes.
Sandi, thank you so much for coming today. I
Thank
appreciate
you.
it.
Thank you.
All right, that's it for today's episode of the Humn.ing podcast. Brought to you by Zavora Marketing. Want more wellness? Grab a free guide that goes deeper into today's topic at human.ing/episodes. And if you're not already following along on Instagram, I'm over at human.ing, sharing more behind the scenes, reflections, and ways to keep humaning through life. Okay, it's your turn. Go human the hell out of today.